Does obesity cause overactive bladder due to hormones? Obesity and overactive bladder are connected, but the main reasons are more about physical pressure and inflammation than hormones alone. Let's explore how excess weight affects bladder health. The biggest factor linking obesity to overactive bladder is mechanical pressure. When someone carries extra weight, especially around the belly, it increases pressure inside the abdomen. This pressure pushes down on the bladder, making it harder to hold urine and causing urgency or frequent trips to the bathroom. The more visceral fat a person has in the abdomen, the greater this pressure becomes. It can also stretch and weaken the pelvic muscles and tissues that support the bladder, making control more difficult. In addition to pressure, obesity causes chronic low-grade inflammation throughout the body. Fat cells releases chemicals called cytokines, such as tumor necrosis factor alpha and interleukin-6, which irritate the bladder lining and make nerves more sensitive. This inflammation can disrupt normal bladder function at the cellular level. It also leads to oxidative stress and reduced blood flow to the bladder, which can damage muscles and nerves involved in bladder control. While hormones do play a role, they are not the main cause. Hormonal factors linked to obesity include insulin resistance and metabolic issues, which are connected to inflammation. For example, prostaglandin E2, a hormone-like substance, influences inflammation and insulin resistance and can affect bladder control by triggering urethral contractions. However, these hormonal effects mainly work through inflammation and metabolic pathways rather than directly causing overactive bladder. Research shows that where fat is stored matters more than total weight. Abdominal fat, measured by the waist circumference or the waist-to-hip ratio, has a stronger link to overactive bladder than overall body mass index. This highlights that fat around the belly creates more mechanical pressure and localized inflammation, which are key drivers of bladder symptoms. The good news is that losing weight can improve overactive bladder symptoms. Studies have shown that even a modest weight loss of 5 to 10% can lead to noticeable improvements in urinary urgency and frequency. A 12-week weight loss program focusing on diet and exercise has been shown to significantly reduce overactive bladder symptoms in overweight women. If hormones were the main cause, we would expect slower or less noticeable improvements, but the quick benefits from weight loss point to mechanical and inflammatory factors being primary. Gender differences also exist. Women tend to experience a stronger link between obesity and urinary incontinence compared to men. This suggests that hormones like estrogen may influence bladder health, but the main causes still involve physical pressure and inflammation. Understanding that obesity affects the bladder mainly through mechanical pressure and inflammation helps guide treatment. Managing weight by reducing abdominal fat through healthy eating and regular exercise can greatly help alleviate overactive bladder symptoms. Focusing on lowering waist circumference, body fat, and strengthening muscles around the pelvis are proven strategies. In summary, hormones do contribute to the obesity and overactive bladder connection, but the primary causes are physical pressure from excess fat and ongoing inflammation. This means that lifestyle changes, especially weight management, are effective ways to improve bladder health. Always consult a healthcare professional for personalized advice, but maintaining a healthy weight is a key step in managing overactive bladder related to obesity.